Welcome everybody. Good morning, good afternoon, good evening to you all to this COVID-19 briefing from here at the WHO Regional Office for Europe in Copenhagen. I'm joined by the Regional Director for WHO, Dr. Hans Kluge. We'll also be joined in a short moment for some questions and answers for the press by Katie Smallwood from the Incident Management Team here at the within the Emergencies Programme of WHO Europe. We're also going to be joined by Isabel Jordi and Jonathan Passmore, who are two subject matter experts on the topic in which we're going to shed some light today, which will be during the regional director's presentation, that being a focus on violence against men, women and children during or in the context of COVID-19. So thanks very much for the questions you've sent us in advance, and thank you very much for taking part today. We'll endeavour to get to all those questions shortly, but before we do so, I hand the floor to Dr. Hans Kluge, our regional director, to say an opening few words.
Good morning. Thank you for joining us today. It is over 3 months since the novel coronavirus gained a foothold in our region. Over 2 months since Europe first documented community transmission, and just over 1 month since we observed the virus move east across the European region. With a total of 1.6 million cases and almost 150,000 deaths, the European region accounts for 45% of cases and 60% of global deaths associated with COVID-19. I am sorry for the loss of every grandmother, grandfather, mother, father, sister, brother, son or daughter during these times. For almost 4 weeks, since 12 April, we have seen a decrease in the number of cases reported per day in the European region. Slowly but surely, we are seeing positive signs. Unfortunately, we cannot say the same for all countries. The situation in the eastern part of the region remains a concern. Belarus, Kazakhstan, the Russian Federation and Ukraine have seen increases in new cases over the past week. This week, we have an expert mission on the ground in Tajikistan, working with national authorities and health providers to respond to the outbreak in the country. It is the latest of over 60 missions we have conducted across the European region during this pandemic, providing guidance on a range of technical areas, including laboratory testing, disease surveillance, operational planning, hospital preparedness, and of course, to help countries respond. Today, looking at the measures in place across the region, 43 countries have implemented partial or full domestic movement restrictions, and 32 countries are moving to ease some of the public health and social measures as they manage to suppress the transmission of the virus. The situation remains very fragile and could quickly relapse if the basic measures are not scaled up, their surge maintained, and if the transition is not planned carefully and gradually. The past month of restrictive measures and lockdowns have understandably bred stress and anxiety. Social networks are disruptive, and insecurity and financial strains with jobs in jeopardy. For many, uncertainty, separation, and fear are part of daily life. All of these factors compound the issue I would like to address today. WHO is deeply troubled by the reports from many countries, including Belgium, Bulgaria, France, Ireland, Russian Federation, Spain, UK, and others, of increases in interpersonal violence, including violence against women and men, by an intimate partner and against children, because of the COVID-19 response. Although data is scarce, member states are reporting up to a 60% increase in emergency calls by women subjected to violence by their intimate partners in April this year, compared to last. Online inquiries to violence prevention support hotlines have increased up to 5 times. Our United Nations partner, UNFPA, has sounded the alarm loud and clear. If lockdowns were to continue for 6 months, we would expect an extra 31 million cases of gender-based violence globally. Beyond the figures, only a fraction of cases is ever reported. We talk a lot about numbers and statistics, but we must not for a moment forget the human side, the women and children who are living this reality day in and day out. Today I have 3 messages. First, to governments and local authorities, this should not be considered an option. It should be considered a moral obligation to make sure services to address violence are available and resourced, and expand hotlines and online services. Second, to communities and the public, violence is not a private matter. Stay in touch, contact and support your neighbors, acquaintances, families and friends. If you see something, say something. And third, to those experiencing violence, violence against you is never your fault. It is never your fault. Your home should be a secure place. Get in touch safely with family, friends, shelters or community groups that have your safety and security at heart. There is no excuse for violence, and we must have zero tolerance of this misuse of power, be it physical, sexual, emotional, neglectful or financial. Violence of any kind and at any time against women, men, children or older populations must not be tolerated. Older women, people with disabilities, those who are displaced or are refugees, and those living in conflict-affected areas are especially vulnerable. Those are the people it is our responsibility to protect. Before the pandemic, in the European region, 1 in 4 women and 1 in 3 children had experienced physical and or sexual violence in their lifetime. This is unacceptable. Evidence shows that interpersonal violence tends to increase during every type of emergency. This requires our urgent action. Out of school, at-risk children are off the radar of education and social sectors. With prevention and protection service on hold, those in need cannot access essential social services and care, nor be reached by those services. In lockdown, women and children are out of society's sight, but more exposed to perpetrators at home. The measures required to prevent the transmission of COVID-19 have challenged our ability to prevent and respond to violence when and where it occurs. However, there are examples where countries have addressed this. Italy has an app to ask for help without a phone call. Pharmacists in Spain and France can be alerted through code words. Hotels in France and Belgium have been converted to shelters. Greenland has limited the sale of alcohol to make the home environment safer for children. Also, sharing information on where to get help, increasing awareness of the signs of violence, expanding helplines, maintaining programs on social and parenting skills, following up on pre-existing situations can all make a positive difference. Let us share and learn from these examples. We at WHO have published guidance on what the health sector can do. In the coming days, we will be releasing an overview of key action now and in the future to prevent and respond to the surge in violence against children, women, men and older people. There is no single solution. This must be a whole of government and a whole of society response. With job losses, rising alcohol-based harm and drug use, stress and fear, the legacy of this pandemic could haunt us for years. So much related to COVID-19 has been unparalleled and is outside our control and understanding. But with solidarity, we can prevent violence from blighting the lives of generations. Shining a light on violence is a first step towards perpetrators being held accountable. Exposing this violence helps victims receive the justice, care and treatment that they need. Let me repeat. 1. Keep health and social services running. 2. Stay alert to the safety and well-being of those around you. And 3. Keep in touch with those you trust and can support you. And please remember that violence is preventable, not inevitable. Thank you.
Thank you very much, Regional Director, for that opening statement. Right, we're going to get to some questions from the press now. I'm encouraging you to raise your hands, of course, in the WebEx system so that I can see you and address your question. The first I'm going to go to, however, is one that was sent to us in advance by Ms. Oksana Naralenkova from the Komsomolskaya Pravda newspaper in Russian Federation. And the question is to Jonathan and Isabel, who are online with us today. And it reads, people in Russia have been on self-isolation for more than a month, exacerbating anxieties and fears, which often translate into aggression towards those nearby. What can be advised in such a situation? I'm going to go over to Jonathan Passmore first, and then I'll pass the floor to Isabel Jordi. Thank you, Jonathan.
Thank you. Excuse me. Thank you, Rob, and thank you for that question. Anxiety, fear, stress; these are all human emotions that are at a heightened state during this pandemic. So it's very understandable what people in many countries are feeling. However, we do have to acknowledge that interpersonal violence was a significant public health and human rights issue in all countries in our region before COVID, with multiple reasons, including the persistence of gender inequality. There are no circumstances where the violent expression of those emotions against another can be accepted. One of the main purposes of this briefing has been to highlight the extraordinary circumstances surrounding COVID-19 that have exacerbated the existing risks of interpersonal violence even further. And the importance of continued access to mental health services and the dangers of harmful alcohol consumption have already been addressed in this series of press briefings, as well as WHO guidance that have been released as part of this pandemic response. They are also highly pertinent in this context, as well in preventing anxiety and stress from manifesting into aggression and violence. WHO and other international partners have published extensive guidance on the prevention and response of interpersonal violence in different population groups in different contexts and settings. The challenge and opportunity now is to adapt these strategies and apply them to the situations of movement restrictions and lockdowns. Already we are seeing these innovations in many countries in the region. For example, in linking victims to various forms of support, care and treatment through online technologies, as well as the utilization of non-traditional safe spaces and settings, and as well as providing circumstantial support strategies to parents and caregivers in relating to their children. Thank you.
Okay, thanks very much, Jonathan. Isabel, would you like to add anything to what Jonathan said? Isabel Jordi.
Yes, thank you. Not so much, just the emphasis that many countries have been doing on differentiating before social distance and physical distancing. And I think it is very important to use all the resources that countries are putting out there, like hotlines, that online, and even keeping essential services on the social and health services, so that we don't feel that the physical isolation also cracks our social outreach. And we also recommend very much that in our guidance to have a safe plan. So you have to, if you are in a situation of violence, and you have to have a safety plan. You have to reach out to those that are close by, that you may not have done it in an open situation, but do it now. And as Jonathan says, we have clear guidelines on that, and we also have good experiences from countries, particularly on hotlines, and also the role of civil society has been tremendously useful. So use those resources.
Thank you very much. Thank you both very much. Okay, I'm going to go over to Jaromir Mrhal from the Czech news agency. Jaromir, can you hear us? Are you with us?
Yeah, I can hear you.
Please, go ahead.
Thank you. Okay, my name is Jaromir Mrhal from the Czech news agency. I would like to ask about the vaccine. How do you assess the search for the vaccine so far? And when do you think it could be ready? And maybe the second question, do you support the search for vaccine at the national levels, or should the states cooperate more and share the research results? Thank you.
Thank you for both of those questions. I'm going to pass them both over to Katie Smallwood, who joins us today from the Emergencies Programme here in Copenhagen. Katie.
Thank you very much. I hope you can hear me, Jaromir. I don't think I caught your name perfectly well, but indeed, WHO is helping in the coordination of the global efforts for the search for a vaccine for COVID-19. That's also supported by a wide range of international private sector and funding initiatives that have come together to really support this process. In terms of the numbers of vaccines that are under development, it's certainly in the dozens. Several different institutions, research institutions, governments are involved in the process. And at the moment, we would have half a dozen, 6 or 7 vaccines that have now entered early clinical trials. This is very encouraging news, but we have to be extremely realistic that vaccine development takes a long time. And there are several hurdles along the way that will still present themselves to vaccines. So what WHO has been saying in general is that we should really be expecting it to take an 18-month process in general, which is an accelerated form of the usual several years that it would take to develop a vaccine. We're, of course, involved in increasing the international collaboration for vaccine development, research and development, and we would certainly encourage further international collaboration in this regard, and WHO is really leading in this respect. We have a research and development blueprint that lays out all of the processes for finding a new vaccine, and we encourage vaccine developers and research institutions that are involved to come into this process, join with the international groups that are working with it, and benefit from the information and the evidence sharing that will come from that. Thank you very much.
Thank you very much. Thanks very much for that question and for that response, Katie. Okay, we're going to go over to David Williams from the Xinhua News Agency. I think David's here in Copenhagen. We didn't get to your question last week, David. My apologies. So we'll try and tackle one of yours now. David, are you with us?
Hello?
Hello, David. Please go ahead.
Great, thanks. Sorry about that. My question concerns data. The US CDC director calls data a very powerful weapon against the virus. But there's been increasing criticism of discrepancies in the way numbers are calculated in Europe. My question is, has data become politicized in Western countries? And is this affecting the work of the WHO?
Okay, question on data for you, Katie. Again, if I could pass the floor on back to you. Thanks. Thanks for the question.
Thank you, David. Indeed, data is a very powerful tool here, and the way we interpret it is important. When it comes to data being collected and shared with WHO, we have requested member states under the international health regulations to share with us on a daily basis reliable data on cases and deaths. This is something that we've done since the very beginning of the outbreak, and we're very confident in the data that we're receiving from our member states. Those data are used reliably by WHO to look at trends in different countries. The difficulty comes into comparing data between different countries and contexts. And of course, we recognize across the board that there have been challenges and gaps in the data being collected, especially when looking at specific granularity of that data. And so we've always been cautious around using that data and comparing one country against another. And that's our position with regards to that. We really need to look at the country by country context, understand the data that we have coming from countries to WHO, but also looking at the extensive reports that are coming out through the ministries of health, looking in much more detail at what's going on at the country level and looking country by country. Thank you very much.
Okay, thanks very much, Katie. I'm going to go back to the second question that was put forward to us in advance by Ms. Oksana Naralenkova from Komsomolskaya Pravda newspaper in the Russian Federation, and this is was for the regional director. Many are isolated in isolation without physical contact with friends and family. How can they maintain their mental health, especially older people who find themselves in solitary isolation? Regional director, please.
Right. The key issue is that one size does not fit all. So everyone has to find a kind of a plan or a strategy for him or herself. But there is some generic WHO guidance, like the social connections have been proving very, very important. And their digitalizations, phone calls can help a lot. But it's also crucial to establish a kind of a daily routine or to create even new routines. Take care of the healthy eating, the rest, the enough night sleep, and in addition, what stresses people quite a bit also nowadays is that there is an infodemic. So there is so much information. So sometimes it's good at certain routines in the day to get your information, to read, and also to limit it sometimes. But everyone has to look a little bit what works for him or herself. The routine, the connectiveness, to stay positive, and according to your own capacities to stay physically active are things that have been proving working.
Okay, thanks very much, Hans. Okay, next we'll go over to Esmir Milovic from N1 TV in Bosnia-Herzegovina. Esmir.
Hi, I can hear you.
Yeah, we need a little bit louder if you could. Thank you.
Yeah, I will go a little bit louder. I have two questions. My first question is, have you collected any data which goes in relation between air pollution and deaths due to COVID-19? Because we have seen some studies in the recent weeks correlating these two elements. So that's my first question. And my second question goes with what Dr. Kluge have said, worrying about what could happen in the future, because we are seeing more and more larger gatherings, especially in churches and mosques, and Eid is coming here in Bosnia and in countries where we have Muslims. Have you worried about those large gatherings at once in one place? Could that make a rise in the numbers in upcoming weeks? Thank you.
Thanks very much, Esmir. So the first question, I think, goes to Katie, and that was regarding is there correlation or association with air pollution and COVID-19 cases and the outbreak pandemic, and the second question to the regional director. So Katie first, please.
Thanks very much. And yes, we've been reading with quite some interest the reports that have been coming out regarding decreasing air pollution that has been associated with some of the public health and social measures implemented in countries. In terms of its impact on the number of deaths, it's too early to say, and I'm sure people will be looking into the different impacts of the lockdowns in terms of air pollution and its correlation with deaths. However, what I would say is in the European region, we have seen over the past few months an increased excess mortality across the region. And that's been really associated with COVID-19, alongside potential excess mortality due to other indirect consequences of COVID-19 disease as it's spreading across the community. So disentangling some of this data will take a little bit more time, but of course, impact on air quality will be something that some of our other teams in WHO will be looking at very, very carefully over the next few months. And I hand over to the regional director for the next question.
Dear Esmir, indeed, from the 43 countries which were implementing restrictive domestic measures or lockdowns, about 32 are now gradually opening up. And you make a very fair point over there that it is not because the people have been put in lockdown that all of a sudden the virus has gone away. So this has to be done in gradually and carefully based on data. WHO has published guidance on this. Tomorrow morning we're gathering the 53 ministers of health with a panel of 6 ministers to share the early experiences, because there is no right or wrong, but it has to be really keeping in mind that it's not a time for celebration, but a time for preparation. There is a very important day coming in front of us, the Victory Day, the 9th of May. And I would like really to commend those governments who have made the brave decision to either postpone or alter Victory Day, the parades, to really put health at the center. We have here in the regional office a great respect for that historical day, but this is indeed the time to look for alternative solutions in order not to jeopardize human lives.
Thanks for those questions, Esme, and thanks for the responses. So next we're going to go over to Evie Mitsidou-Phillips from the Cyprus News Agency. Evie.
Hello, can you hear me?
We can. Please go ahead.
Okay. Thank you for taking my question. Here in Cyprus, it was announced recently that as of May 21st, all schools will start opening gradually on a rotation basis. And what I would like to ask is whether, when do you consider that it would be safe to open schools, and particularly concerning younger children of preschool or early elementary age, who might not be as disciplined as older children? Thank you.
Thank you very much for that question. It's a question that's consistently come up over the last couple of weeks. So I'm going to pass that over to Katie Smallwood to respond. Please, Katie.
Thank you, Evie. Absolutely. So as countries begin to shift some of the measures that have been implemented, especially those that have been proving more restrictive, we do have some general recommendations for all countries in doing so. And I think the when is very important. So when should countries start to do this? Certainly when they have a very good grasp of the epidemiological situation in the country. What does that mean? That they understand where the virus is, how it's spreading, and that they're able to really identify all suspect cases, test them, isolate them, and then follow up with any of those contacts. And that's a very important process to be ramped up during this period. But also understanding the latent risks that will occur as certain measures are lifted, others shifted. And I think when it comes to schools, WHO will be issuing guidance specifically on schools in the coming days. And when it comes to children who are very young and maybe do not understand the difficulties in keeping distance and applying some of the measures and the physical distancing measures that as adults we're all quite familiar with, we do need to be particularly careful. So closing schools has been a significant feature in many of the countries that have implemented widespread social measures. The evidence for this is somewhat mixed and maybe different in different countries. And how schools are reopened and how children go back to school, which is very important because children have suffered disproportionately from staying at home, it's very important to really take a cautious approach to understand how children and how the processes in schools that are reopening can be managed, the feasibility of those, but also to monitor the context and to, as schools reopen, to allow this 2-week window, this incubation period that we have, to be monitored very carefully so that each step in reopening schools or taking other measures is monitored over the following 2 weeks to look at how the epidemiology changes with that shift of measure. And that applies for schools just as it does for businesses and any other measures that are shifted at the country level. Thank you very much.
Katie, thanks very much. I'm going to follow up because there's a question related to this, but it's not quite the same. Oskar Gorzinski from the Polish press agency, his question on the following last week's press briefing where we had Adam Finn with us, and it was related to children's ability to transmit the virus. He asks, there was a German study showing that while viral loads in children don't differ and they can spread the virus, they are less vulnerable to get infected. Is that consistent with the state of our knowledge about the virus? Could you say a few words to add to that? He's specifically relating this to a German study that I think we're familiar with.
Yeah, thank you. We're familiar with the German study and several other studies that have come out, including our own investigations based on the data that we've received and the missions that we've had to countries like China and Italy, where the role of children was looked at. The evidence is still being collected, and we still got a lot to learn about the role of children in transmitting the disease. Certainly in household settings, there seems to be a role, but it doesn't seem to be that children have a significant role in driving the spread of COVID-19. Indeed, children get less sick, and when they do get sick, we do see lower severity among children and deaths. So very few deaths have occurred among children, and where they do occur, they are rare. Children, however, have lost out on a lot during COVID-19. And I think we do need to recognize that the welfare of children has been affected. Keeping children at home for long periods of time is very difficult, and they lose out in their social interactions as well as the educational schooling that they would otherwise have. And especially linking back to the special topic here, which is around violence, especially vulnerable children who may be living in vulnerable settings, will be exposed to this type of violence, as will other adults. And children who are living in poorer settings may not have access to the same level of services and continued educational services that other children may also have. So certainly in terms of disease, it's milder, but children are affected in other ways too.
Thank you very much, Katie. I'm going to go over to Naomi Christian from Bloomberg News. Naomi, welcome back. We can't hear you at the moment, Naomi.
Oh, I'm sorry.
That's okay.
Can you hear me now?
We can. Please go ahead.
Okay, great. Thank you. I have a two-part question. The first is, what do you think about the potential for the UK to relax its lockdown starting on Monday? Is this too early? And then second, what are you currently modeling in terms of a second wave of the virus in Europe? And as countries loosen restrictions now, what should we expect in terms of another wave of infections, and what factors will be the most important in determining the timing of a second wave?
Thanks. Katie, I'm going to pass that over to you again. Thank you.
Thanks, Naomi, for the question. Absolutely. In terms of relaxing measures or shifting the public health measures that countries have been implementing, WHO's advice to the UK is the same as our advice to all countries, that there should be a risk assessment that thoroughly looks at the context of the epidemic in the UK and takes into account all of the epidemiology that the epidemiologic indicators, in fact, that are being assessed on a regular basis in different countries, the UK included. That includes the positivity rates of testing that's been conducted. That includes the increase in cases and the increase or decrease in incidence. And we would really look for a sustained decrease in incidence before countries start to move away from some of the more restrictive measures. And of course, that this is done in a step-by-step manner, that it's gradual, and that it's extremely cautious, and that every time one measure is shifted, sufficient time is given to really assess the impact that might have on how the cases continue to spread or do not, or whether there's an increase in spread of cases. And then finally, absolutely the transition away from restrictive measures really needs to be flexible and adaptive. And if there's a change in the increase in cases, countries really need to be ready to reverse some of those measures that are taken. In terms of modeling, WHO is following a lot of different groups that are conducting modeling and looking at the potential scenarios that could occur. We have to be quite cautious when interpreting those modeling results. They have their caveats and they're extremely useful in looking at potential scenarios. But what's most important is that we really look at the epidemiology and the context. And what we do know in terms of the prevalence of the virus across our populations is that it is low. So there is, of course, a risk for a new wave. When and how and the extent of that wave is really dependent on the measures that individual countries, communities, and settings take. So it's very difficult to generalize in that regard.
Thanks very much, Katie. Isabelle Jordi, I'm going to go over to you next because we have a clarification question from the Agence France Presse, and it's related to the increase in emergency calls by women subjected to violence by their intimate partners in April this year that the regional director referred to. Is it only in the countries that are listed, that were listed by the regional director, those being Belgium, Bulgaria, France, Ireland, Russian Federation, Spain, and the UK? Can you elaborate on that a little bit? We had a follow-up question from the Agence France Presse Agency.
Yes, thank you. Well, data is quite scarce, as the regional director said, and the reports we are having sometimes are not, the data cannot be interpreted. These are increases on violence. Many of the data we have is increase of calls to hotlines, which makes sense because hotlines may be the only service available for many women. We have contradictory data. In Italy, we have a decrease on these calls, but all over most of the countries, we had it also from China, from the States, from other regions. We do have increases on reporting. And we do know that from previous emergency situations, Ebola, SARS, other type of emergencies from climate-made emergencies, violence against women and children increase. The risk is there. Lockdown measures increase that risk. But we are conducting rapid assessments, and we know that, and we are collaborating with other UN agencies, UNFPA, UNDP, UN Women. They are all paying attention to the issue of violence against women. We have countries like, for instance, this morning we were discussing with Armenia, where there is also an increase of the calls reported by civil society, but a decrease on calls made to police. That may also give us some light on what services women are using more, have more access, are trusting more. We know that in Italy, for instance, 98% of the calls are made by Italians, which means that we know that there is an indication of women belonging to a migrant community being more isolated from the services provided. So we have increased on reporting from almost all countries. Some are provided by civil society, some by governments. We will have to look at that data carefully, but what we can say is that the room for that increase is there, and the reports are increasing. But it is important that we understand the data, and we will have to keep on working on the data received for the next months to come. Thank you.
Thank you very much, Isabel. Okay, we're going to go over to Georgi Popova from Georgian National TV channel. Georgi, can you hear us?
Yes, hello to everyone. Thank you.
Please.
Can you hear me?
Yes, a little louder, please. Thank you.
Can you hear me? Yes, I have two questions. Mr. Kluge. First one is, do you have any kind of recommendation of treatment protocol in Georgia? Can you hear me?
Can you repeat that question, please?
Do you have any kind of recommendation of treatment protocol in Georgia? And second one is, I have one more question about vaccine. The Georgia is participating in the experiment. Well, this is the first time in Georgia using plasma pharms. Do you have a recommendation about that one?
Georgi, I'm sorry, I didn't catch either of those questions. I'm looking to Katie on the screen because there was a vaccine question there, but did you catch that, Katie? I think we're going to have to ask Georgi to maybe get back in touch when he's got a clearer line through to us. Georgi, I'm sorry, we didn't hear either of those questions, so I'm going to have to move on.
I will try to catch clear line. Sorry, can you hear me?
Yes. Can you just repeat one of the questions? Let's just take one of the questions.
Do you have any kind of recommendation of treatment protocol in Georgia?
Treatment protocols. Katie.
Yes.
Thank you, Georgie. Yes, WHO has clinical guidance, and that includes protocols for treatment, and this is under constant review based on the evidence that we have. So we would encourage Georgia to look at our WHO website, where all of our guidance is listed and available to all countries. With regards to treatment of COVID-19, I would also refer to the clinical trials that are ongoing in many countries that are looking at the efficacy and use of specific therapeutics, both in combination and on their own. And we would encourage countries to be part of the initiative that WHO is coordinating, which is the Solidarity Trial, which is looking at 4 different protocols of treatment using randomized controlled trial settings and a clear protocol for treatment for those 4 therapeutics. So thank you for the question. Certainly, we would recommend countries look at the WHO guidance until further evidence is available on specific therapeutics.
Thanks very much, Katie, and thanks for the question, Georgi. We'll go over to the Daily Record. That's Vivian Aitken. Vivian?
Good morning. Thank you for taking my question. I'd like to ask, today we seem to be gearing up in the UK to relaxing of restrictions. However, in Scotland specifically, the First Minister seems to be having an opposite view. Does the regional director think that in an island setting like the UK, everybody should be coming out of restriction at the same time, or is there an argument for it to be done country by country?
Thank you. So every context is different. What is the most important is that it is driven by public health data. So it is evidence informed. This is number one. So this means that national and even subnational, there can be a different timing. At the same time, what is as important is to look across the borders, particularly if borders are going to be opened and traffic is going to be increased. That is also an international collaboration. It does not mean that everyone has to do the same thing, but the same set of principles which are embedded in our framework of transition, and we have 6 very clear criteria, is something indeed that we strongly recommend the countries to adhere it.
Thanks very much. Okay, we'll go over to Ryan Hooper, PA. Ryan?
Hello, yes, I want to pick up on Dr. Kluge's mention about the sort of legacy of the coronavirus. Obviously, a lot of people missing social interactions will possibly be enjoying alcohol in their own homes. Regional Director, is your advice then, or your message for people to quit alcohol or limit their alcohol consumption while lockdown measures are in place?
Yes, this is definitely one of the recommendations. So that definitely to limit. Of course, everyone has to look at the own situation. The same goes, by the way, that we say the COVID-19 response is a additional moment to grasp, to quit smoking. But this has to be looked in a broader atmosphere, right, of behavior, how the persons are feeling. But to put it short, alcohol is a very bad advisor. Thank you.
Well said. So we go over to Tom Magner. Tom from Kerr's World Radio. Welcome back, Tom.
Thank you very much indeed. Can you hear me okay?
We can. Please go ahead, Tom.
Excellent. Thank you. Thank you. I'd like to bring the discussion back to your main theme of the day and interpersonal violence, which is, of course, a critical human issue. And you've given a very clear message today. I just want to ask you about the practicalities, because if someone's in that situation, they're going to have difficulty getting the privacy in these lockdown conditions to be able to make that critical call for help, possibly can't even go online. What's your best advice to someone in that situation?
Thanks very much, Tom. Right, I'm going to go over to Isabel or Jonathan. Jonathan, should we start with you? Jonathan, could you respond to Tom's question, please? Thank you.
Yeah, thank you very much for the question. It is certainly a challenging situation, because we do know from research and experience that that attempts by women and children, for example, to seek assistance, especially when they are discovered, can actually lead to an increase in the frequency and severity of the violence that they experience. So having those opportunities to do so in safety and security is crucially important. This is where one of the initiatives and adaptations of approaches that we're seeing with calls for services and calls for support moving into different technological platforms. And the regional director mentioned the app services that are being used in some countries, where it's not related to a call, or you can utilize websites or utilize SMS services, for example, to seek that assistance. Many calls for assistance are also going through websites, and one of the features that is very prominent on some of these websites for providing services is a rapid exit button, which gives people who are seeking assistance a very rapid departure from a site if they are discovered by an intimate partner and potential abuser. Thank you.
Isabel, would you like to add to that? Anything to add?
Just that, reiterate what Jonathan said, and because of this extremely difficult situation, to highlight the role of the health and social services, not to leave these women and children on their own, and recognize that this increase of violence, it's a known risk. So a plea for health services and social services to keep this basic outreach event for families that there is a previous situation of violence, to keep on monitoring what it is, the situation, and outreach to and reach out to these women and children, keeping the basic services alive. Thank you.
Over to you.
Tom, you make a very good point there, that when you talked about the children, because children are particularly vulnerable and may not reach out through those digital platforms. That's why I mentioned the whole of society responsibility. It is everyone can do something to reach out when the neighbors, the other, often the children will go to someone of the same age, right, who is hopefully in a more protected environment and can provide some signals. Because either sometimes the children are culpabilized, that they think it's sometimes their own mistake, or very difficult, or afraid for some revenge. So it's a very, we acknowledge, a very delicate, a very humanistic situation. And there is where really the society has to come in as a whole and then call in the help of other services. Thank you.
Thank you. Thanks very much. So we'll go over to Denise Rowland from the Wall Street Journal. Denise?
Hi, can you hear me?
We can. Please go ahead, Denise.
Hello. So my question relates to serology testing. A question I've been getting from lots of readers since writing about the Roche test, which I think is one of the most sensitive and specific on the market now, is effectively, should I get a test? And if I do, what will it tell me? And I was just interested to get your advice directly to individuals. What is the point of getting one of these tests? What does it tell you? And could it be used to make calculated risk decisions on individual behaviours?
Thanks very much, Denise. Katie, over to you.
Thank you, Denise. And this question has come up quite frequently in the past few weeks, as well as a question around the use of so-called immunity passports. And I would certainly recommend that you take a look at WHO's stance with regards to immunity passports that's on our website. Serologic tests there are many. Many have different levels of sensitivity and specificity, as you've alluded to. Currently, WHO is still in the process of reviewing many of those tests, and will issue a statement as and when we feel that a test has been sufficiently validated to provide reliable results, and that will be done through our emergency use listing procedures. As to the use of the tests so far, WHO's recommendation is that they are useful for research purposes, not on an individual level. But in order to look at the level of spread of the infection across populations. And in the European region, at the moment, we have several countries, I think 9 countries, that are currently conducting serological surveys of their populations and are providing WHO with information on those surveys. And at the moment, what we can quite clearly say is that the level of prevalence in countries that are doing these types of surveys is quite low, around 2 or 3% at the population level. In areas where there's been very widespread transmission, that has gone higher. But it certainly doesn't give a sort of high population level immunity. And as for the tests, as for how they should be used, countries will be continuing to do these surveys over time to look at the overall prevalence of COVID-19 in our populations, and that will drive public health decisions and not at the moment individual decisions. For individuals, diagnostic testing is on the basis of molecular testing, which is PCR, and that should be done when patients, as early as possible, when they are symptomatic.
Great. Thanks very much for the question, and thanks for responding to that question, Katie. We go over next to Isabel Sacco from EFE. Isabel.
Yes, hello. Do you hear me?
We do. Please.
Good morning. Thank you for taking my question. Firstly, there was a noise interference while Dr. Kluge was telling the figures that showed the increase of violence in Western Europe. So if he kindly could repeat that figure. And my question, and I have one question on children again, is children are going back to school in Switzerland next Monday, and this decision was based in the fact that Swiss authorities, health authorities, say that children are not vector of the virus, of the coronavirus, and they have encouraged children to meet their grandparents. So I would like to, I hear all that has been said about children, but could someone say clearly if children are vectors of the coronavirus?
Okay, thanks. So to the first question on the RD's statement, to the regional director's statement, that will be online. Yeah. So let's move on from that. That will be online straight after this press briefing, of course. So to the second one, I will turn to Katie regarding children and virus transmission.
Thank you very much, Isabel, for the question. I think we need to learn more about the role of children. As I briefly alluded to earlier, we still have a little bit to learn in terms of the specific role of children in transmission. Based on the evidence that we have so far, it's clear that children may not play a major role in driving transmission at the community level. And the evidence seems to imply that children may have a role in transmission at the household level. So that's as much as we can say at the moment, but as and when we have further evidence to really say something more specific, WHO will surely do so. And as studies come in, on a regular basis, we are reviewing those on a day-to-day basis and adding that to the global body of knowledge that we have available to us. Thank you very much.
Thank you very much indeed. Okay, so we'll go to Interpress News now, to Salom Abulashvili, excuse my pronunciation.
Yes, it's correct. Thank you very much for the opportunity. Do you hear me?
Please go ahead.
Sorry, can you hear me? Okay, thank you. I would like, first of all, I have two questions, but first of all, I would like to ask, how do you assess whether the efforts taken by China and other European countries were sufficient and timely? Do you think that if some strict restrictions had been introduced earlier, we could have a completely different picture amid to an outbreak of coronavirus in the world and especially in Europe? And my second question is, Georgia received a request from the World Health Organization to participate in Solidarity clinical trial for COVID-19 treatment, and Georgia expressed, of course, its readiness to participate in this trial. But my question is, on basis of what criteria was Georgia selected for the trial when it has one of the lowest transmission rate in Europe?
Okay, thanks very much. So two questions there. First on the sufficient and timely response of member states, and the second on solidarity trials. I'm going to go over to Katie to respond, please, if I could. Thank you, Katie.
Thank you for the questions. So first of all, on the timely and sufficient response, WHO and all member states took the response to this new emerging virus very seriously from the very beginning. And as our Director General and many of our colleagues have illustrated, all countries, including China, moved very quickly in the early stages of the disease issued the sequence extremely quickly, much more quickly than had ever been expected before. Which enabled other countries to take very quick measures. WHO sounded the alarm very quickly with the declaration of a public health emergency of international concern at the end of January, and a call to all countries really to grasp a window of opportunity there, and countries did. However, the virus continued to spread and surpassed the levels of spread that any of us expected. And I think here what we need to focus on is the task at hand. And we are seeing positive signs from many of the countries, especially those who are most affected in the European region first. And we're seeing very positive signs from other countries that took early measures, such as Georgia, and have seen a relatively low number of cases compared to some of the other countries in the European region. So what we have seen is countries learn very quickly one from the other. Of course, we will be looking backwards at a certain stage to see what each of us could have done better. WHO will be doing that for our own response, and we will also encourage all countries to be conducting after-action reviews when that time presents itself. But for the time being, let's focus on looking forward, continuing with the initial signs of progress that we're starting to see, and being extremely vigilant that the virus does not return and cause additional morbidity and mortality in our populations. On the second question with regards to the Solidarity trial, yes, indeed, as you say, Georgia is not the country that has had the highest number of cases in the European region or globally. However, the whole point of the Solidarity trial is that all countries can participate. And so we have invited all countries to submit interest and then to go through the approval process with WHO and guiding through a systematic and standardized approach to the trials. And that means that all of the enrolled patients in the trials the data from those will be pooled into a set of data that will really be able to use every single patient's information to inform a global assessment based on a very large number of patients. And this is really going to produce the most reliable and robust data.
Thanks very much. And on that note, I'm going to, I see it's the top of the hour, so I'm going to close this briefing. Thank you very much for joining us today. Looking forward to seeing you next week, the same time, at the same location. In the meantime, take very good care of yourselves and stay well. Thank you. Bye-bye.